Well, we are covering the ANS 3.0, the annual Nephrology Summit. And to talk more about this event, we're joined by Dr. P.P. Varma, sir. Thank you so much for speaking to News.
Thank you very much. I think ANS has become a much looked after event. People are waiting for this event. I think Dr. Khuller started this 3 years back, and it is somehow covering most aspects of nephrology which are relevant as on today. More importantly, there is enough time for excellent speaker. But the India renowned speakers are being called, and excellent time for discussion because each session has got a speaker and equivalent time or more time is given to discussion. That makes the session more fruitful and more absorbing. I think most, and there is enough time for any Q&A. So that is all what is required in a session: the clear update, the clear panel discussion, and the clear takeaway points, which are being done in this conference. I think excellent. The conference is going in an excellent way.
And so, as a nation also, in terms of healthcare, if I say, we have evolved humongously. Now, if we talk about this summit itself, how different it is from the early years and how has this ANS 3.0 evolved over the past 3 years, three summits that have happened?
That's a very difficult question, but whatever I have been seeing, I have been attended practically all the sessions. It was a smaller sessions which are gradually becoming bigger and bigger. The involvement of nephrologists is more, and more importantly, now there is a interspecialty involvement. It's something like if we were talking about vasculitis, there were rheumatologists. If we were talking about cancer therapy, there were oncologists involved. If we were talking about something else, the cardiologists involved. And once you make it interspecialty, that is how it is growing. Gradually, it is becoming the specialists from other specialties are also joining in. That makes the conference more fruitful.
So last question. I just spoke about evolution over the past few years for the nation itself. If we talk about kidney itself, how do you think we are in the right direction? You think we are there or there needs to be done more in terms of maybe educating the viewers or the people itself?
I think we are doing very well. We were not doing very well at least 5-7 years back. The researches in the field of nephrology were limited. But over the last 7-8 years, more and more research is coming, more and more new molecules are coming, which are changing the spectrum and the management of the disease. That is why such summits are important, that whatever new data has come, we can discuss about that.
Thank you so much, Dr. P.V. Sharma, for speaking to us. So, yes, viewers, we spoke to Dr. P.V. Sharma and we are covering the ANS 3.0 Annual Nephrology Summit. This is me, Brian Anthony Thomas, signing off with Canvas Ankush for NewsX. Well, we are covering the